3 or 5 day session with Iboga or Ibogaine may not be enough for some people. They may need a different type, so that when they do leave, they're not in pause.
Got it. And is that post-addiction withdrawal symptoms?
Post-acute withdrawal symptoms.
Post-acute withdrawal symptoms.
So, I mean, it's not just somebody learning about what it is, like the molecule itself, studying the molecule in a classroom, or, you know, it's really about watching people go through this medicine so you know what is going on. How long did it take for you guys to learn how to work with this medicine? How did you go about learning how to serve?
Well, I mean, I've been dosing for 30 years in ICU and emerge and such, and learning to titrate to effect. And so I really have a good understanding already of the body, how it reacts, the different systems, and what it actually means to titrate by effect.
Thank you so much for making the time, Patrick and Michele. This is an exciting little preview of something coming November 22nd, Philadelic, which is a conference on so many different topics, but focusing on legislative movements in the psychedelic space, specifically with Ibogaine and cannabis. But you two are the resident experts on Iboga, and dear friends of mine, and I'm really excited to connect with you guys. And I wanted to dive into a topic that we will not have time on our short 40-minute panel with 5 speakers. So I wanted to bring you here to share some basics about Iboga and Ibogaine and some of the dosing styles, because that could be a conference in and of itself, dosing just one medicine, let alone trying to talk about all of them. So if you wouldn't mind introducing yourselves, a little bit about what you want to share about what you do today, what brings you to Ibogaine and Iboga, and where you're calling in from.
Okay. Well, I'm Patrick. It's Michele. We're both nurses with combined over 50 years of working in the acute care and ICU and emerge settings. And really today, we're really happy to be here to talk about these things. These are great conversations, especially in this time we're moving into, is a real shift happening. So anytime we can be a part of conversations that talk about medicine and talk about the traditions behind it and the kind of the whys and the meat of it, we're more than happy to lend a few words.
Yeah. And we've also been working with the medicine for 12 plus years now. So, and first in sort of more of that sort of clinical way of being, nursing and keeping people safe while they were in the space, and then moving into serving medicine and learning the traditional side of things. So going to Gabon, doing initiations and continuing that education as we continue this work.
Amazing. Yeah. So our panel will be called loosely, I think it may change again. Who knows what'll be on the released publications, but it's really focused on how Iboga and Ibogaine are being used to heal right now. As we know, it's not legal in the United States to do so, but you are in Canada, where it is also not legal technically. But you do travel and bring people down to Mexico. You brought people in Costa Rica. What is Iboga? What is Ibogaine? So people know what that is.
So Iboga, so when we think of the word Iboga, we're referring to Tabernanthe Iboga, which is a shrub that grows in Central West Africa, around in the Congo Basin, Cameroon, Gabon, and just in that area. It is neurogenic, so it's not a true hallucinogenic. It's about creating and walking in the dream, so to speak, is what the translation is.
Ibogaine is one alkaloid of the Iboga plant. So Iboga has over 100, I think, somewhere around that number. I think now the numbers about 15 or 16 have been studied of those alkaloids, and Ibogaine just tends to be the most prolific alkaloid in the plant. So, but you can also get Ibogaine from a few other plants. It just doesn't, it's just not in as high of a quantity as it is in Iboga, Tabernacle Iboga. So it's a beautiful plant, and it's been used for thousands and thousands of years. We don't even know.
And one of the other plants you can get it from is the Vocanga africanus.
Yeah.
And so that doesn't have quite as, the psychedelic effect with it, but it does have a lot of the Ibogaine content in it.
Is Ibogaine also a neurogenic? Is it also classified that way?
Yeah.
The whole plant is,
Yeah.
because it doesn't contain DMT.
Okay, got it. Okay, awesome. And as a neurogenic, what does that mean? Does that mean that it affects different parts of the brain, different systems?
I think it speaks a lot to the way it feels when you're in the medicine. It's not like the same kind of hallucinations you would get on LSD or ayahuasca or psilocybin. It's just unique in the way that you see things. It's more dreamlike. It's less distorted, I guess, in a way. You see things when you do have visions, they're more clear and they're not as wavy, sort of, it's more just like as if you're in a dream, and everything is crisp and clear and makes sense while you're there.
So some of the other things that we'll hear at the conference, we're going to talk about cannabis. There's going to be folks talking about ketamine, some of the things that are already legal in the States in different forms, and psilocybin, working on a few other things. As I understand it, psilocybin and ayahuasca, they work with DMT, which exists in the body, and then the cannabis plant works with the endocannabinoid system. Is there a system within the body that Ibogaine and Iboga work with?
Yeah, actually, our livers produce Ibogaine. So when we ingest Iboga, it gets converted in the liver to Ibogaine and then goes to your different neurons and gets stored in the fat cells.
So we already have it to a certain degree.
I think that's like true of a lot. Our body is designed to eat these plants. Coevolution has made it so that we can reap the benefits of these plants to help us, figure life out.
Yeah. Obviously, we keep planting them and keep cultivating them and creating systems around them. And I think it's just a resurgence at this point of trying to do that in this society versus the previous societies. So you, just for a little bit of background, I call you the Fishleys so that folks know your full names of Patrick and Michele Fishley, wonderful Fishleys. You guys have gone back to the plant's origins in Gabon, correct? And many times to study with a particular tradition. What is that tradition called?
The tradition is the Bwiti tradition. It just means the study of your life, study of life, and how to best move through it and understand yourself, and connect with yourself.
Mm-hmm. Yeah, and there are many lineages in that tradition. So there's Masoko, there's Fang, Sumba, there's many. And so just being aware of sort of the language around that. And then there's also like the Babongo or the Pygmies who worked with Iboga first, before it even came out of the deep, deep jungle into the tribes of Africa, And back then, there weren't all the countries that are there now. It was like, the tribes had huge areas of land that they are part of. So, yeah.
And they work specifically just with Iboga, but in the West, we've done some other things. And that's one is to extract the Ibogaine from the Iboga. There's lots of different versions. Could we talk a little bit about maybe some of the terms that people discuss in the conference? I imagine there's Iboga, the actual root, and extracted, which is Ibogaine, and they call it Ibogaine HCL. Is that correct?
Yeah.
And so there's two or maybe there's more, but there's one from Vocanga, you said, that's not Iboga, that's a separate plant. But then there's also HCL, Ibogaine HCL derived from the Iboga plant. Is there any other places that it comes from?
Not that I'm aware.
No, I don't know. I mean, I know they're trying to synthesize it and all this other kind of stuff, and that's fine. But that's the two main sources.
Yeah.
Yeah.
And when you guys work with it, oh, sorry, go ahead, Kat.
No, and then there's like TA, right?
Yeah.
Which is the total alkaloid. So you can take the iboga and kind of just pull the bulk out, like the wood, like the actual wood of the root. And then you're just left with the alkaloids, but all or most of the alkaloids are there. And then you can take it down even a little bit further than that and get like a even more pure kind of
PTA, which is purified
yeah.
total alkaloids.
So you kind of, and then you get Ibogaine, and then you can even have the residual of what the, they pull the Ibogaine out, but they still have all the other alkaloids, and you can even have that. So I feel like some people are starting to kind of explore those alkaloids without the Ibogaine and see what they do. So,
and one of the things that happens when you start extracting from the whole complete wood bark, right, is when you take out the wood and stuff, then when you're giving your dosages, it's more concentrated. And so in the TA, there's, about 40% Ibogaine in that. So it's more than just in the same kind of milligram for, for the root bark. And in the same way, when you go down to the PTA, there's about 75 to 80% of Ibogaine in it. So it's a lot more. And then when you pull it out even further, then it's mostly all, so around 85, 90% of Ibogaine in the Ibogaine HCL. So it's a lot more. But of course, with that, comes more erring on the side of caution with, this cardiotoxic language people want to use, but it's just, it's how it affects the heart, and especially the QT prolonging interval, which is just where your heart's filling up in between the beats. And we want to really be careful and mindful of where that comes in. So the more Ibogaine you seem to have, the more careful we need to be.
Gotcha. Yeah, and this is a bigger topic for sure, but I mean, you guys have been serving for 12 years. Have you ever, people are afraid of the medicine itself. Have you ever experienced a death personally or really fear? No. So
no.
Is it the medicine itself, do you think, or is it who's delivering medicine?
Well, the medicine itself is fine. And it's beautiful, it's helpful, it's healthy. On its own, it's fine. For example, if you're going to your practitioner because you have depression and he says, he prescribes you an SSRI, and you go to another physician, go, oh yeah, this is not working, but I need it. So he gives you the SSRI and he doesn't cross-check it. Now you're taking 2 SSRIs that can impact you very differently, and it can be very dangerous, raising your serotonin levels super high. So on its own, the levels of, say, for serotonin aren't that high here. When you add anything together, so it's like anything else, because it's medicine.
Yeah. So it really matters knowing the practitioner, knowing what you're on, but also understanding how to dose. So is that as simple as if you just find out that they're free and clear of everything else, you just dose by like how much they weigh, how old they are, like how do you go about dosing? I mean,
because everybody bio transforms the medicine differently. So what one person needs is not going to be what another person needs. And it has nothing to do with weight. It also goes deeper than that. It also has to do with the work they need to do, what their soul is ready for, and it's not just about, it's not that simple. You know what I mean? And I wish it could be. I wish we could make it simple, but the human condition is not simple. We're not simple. We're not simple creatures. We have complexities, and we need to be mindful of that. And sometimes people just need a gentler approach, right? Because they're just not ready to go big, or they need time. Their body needs time. It's a bit of a shock to the body, right? It lights up the nervous system. It's lighting up. It's lighting you up, in a very real way. And the body needs time to adjust sometimes. It's just that simple. And sometimes it's the soul is like, oh, I'm not ready to go there. And we try to force somebody to have a certain experience that they're not ready for, that could be dangerous. It can just, create confusion.
When I was in my medical training and such like that, one of my instructors said, especially around medications and medicines, anyone, well, the actual, which they said was any monkey can give a pill, It's like, okay. And so what does that mean? Because, well, just anyone can give a pill. That's fine. But you need to understand everything about that pill, everything about that medicine and what it does, side effects, adverse effects, desired effects, then how the body and how the different systems work with it, how it could possibly go either way or whatever. There's a whole plethora of things, and then the other component is what Michelle's talking about is the spiritual component of it. There's that part of it too. Then the last component is really understanding, what the medicine is used for, and that not everybody, like she says, not everybody is going to get this dog and pony show. It's you're coming to medicine to work.
Well, I mean, to go to, like, if I went into a medical professional or psychiatric care, if I said I feel depressed and they gave me an SSRI, I mean, I know that a common practice is that they go and they get some of the samples, and aren't those all standardized, measured, like the same, everybody gets the same dose?
Yeah. Starting with
So that doesn't work with Ibogaine and Iboga to do.
Yeah, but even with like an SSRI, they start you on the lowest dose possible.
Okay.
Right? And then if that doesn't work, and then they up your dose to a safe range, right? And so even then there is flexibility. I think there's a couple of things that happen with dosing. One, a lot of the dosing is based off addiction. So what somebody might need to help with addiction is going to be really different, I think, than what somebody needs to help with PTSD, brain injury, just psycho-spiritual, that kind of thing. So I think we need to be looking at why we're giving somebody medicine, and can it be done with smaller amounts? Because this is a finite medicine. This medicine doesn't just grow anywhere. It's, it's very particular. We want to be careful with how we use it. We don't want to be just giving out huge doses for no extra benefit, right? And so I think we need to start looking at that. Like, if we're doing it for, say, brain injury from, concussions and that kind of thing, do we even need to dose at levels of like flood dose levels? Could that be done with low dosing and have the exact same effect?
What could we go through what that means to flood dose, to microdose? I've heard of boosters, I've heard of slow and low. Could we go through what that means?
Yeah. So a flood dose, I mean, it's not a great term, but it just means to flood the system. So putting in a large amount. And that will vary depending on whether it's Ibogaine or Iboga or total alkaloids or the root bark. Doesn't matter. So it's just a matter of getting enough in to get them into the therapeutic window. So that's going to range, and then it's not as simple as going, well, it's 800 milligrams of TA. But for you might only need 100 milligrams. I might need more than that. So it's never really about the amount, but it's about flooding the system, right? So that's kind of with the flooding.
Yeah.
And you get a bigger desired effect. You get more of a shift through all the different ataxic phases and all these things like that.
Yeah. So
for that deeper healing. Yeah.
what we mean by flood, so usually when you flood somebody, their walking is going to be impaired. They're going to need assistance to the bathroom. Their vision might be, they could be really light sensitive. They could have their vision is kind of like wavy, or, lights tend to sparkle more. What else? They may see visions, when they have we can put a mask on, they can lay down. They may have visions. They may not. They may just be super peaceful.
Yeah.
And their mind just might be really blank. They might not see anything at all. They can't hold a thought to save their life. They may get the life review. They may have, there's quite a few different things that people can experience when they're in the flood dose. But usually some of the more physical signs are the walking. They may hear things, within the music or whatever. So those are the flood doses. You have very physical.
And as a practitioner, how do you see that? Because obviously that's their experience, right? How do you know that's going on for them? Like, is there, obviously you can see they can't stand up on their own because,
Yeah.
you know, but when you walk up and to check where they're at, like, what are the things you look for? Is there a change in like skin temperature? Is there,
Yeah.
Yeah.
They can feel warm, they can feel cold.
there's a
Um,
change? So
it's
you know what
about,
the baseline is, and then you see what the change is.
Yeah, there are physical changes and there are things to watch for, and just even just in general how they're going through things. Things change. So it's a matter of just assessing them nonstop and always watching and not leaving them alone
Got it.
yeah,
as they shift through because everyone's a little bit different. You know.
yeah,
And then you got like a low dose, which is kind of like in between a microdose and a flood dose. So they call it like a mesodose, right? And so you're getting more than a microdose, and a microdose is just something that's very small and minuscule, and it's not really to do a lot of visual or interfere with your day so much. That being said, microdosing psilocybin is totally different than microdosing Iboga. Iboga demands that you're intentional. Otherwise, it will stop you in your track. You know, it will make you like just stop. So it's about being really intentional, but that's a very low dosing. You know, when in this mesodose is in between somewhere. So you're going to get a little bit more in depth. And it's going to last a lot longer than a microdose, but it's not the full effects of
yeah.
that. But there's a good range for all of it, and really important to be able to utilize that kind of stuff.
So like low dosing, you might want to do with somebody and have like the whole day, and then also match it with breath work, meditation, you know, something like that, where insights can come a lot more easily, and the mind is a little bit, you know, in the background, and sort of there's more of a connection to self and body. And then, yeah, microdosing, it still can be very insightful and can still bring up. And we have to remember too that Iboga builds in the system. So if we do it, if you do say 5 days of microdosing, every time you microdose, you're going to take, it's going to be a little bit more in the system because it's lasting so long, you know, it's not flushed out so quick. So especially if you've had, say, a flood dose and then you go home and microdose, right? There needs to be an awareness that you have already Ibogaine in your system. And so you're adding to that, right?
Okay.
So I think, yeah, Iboga is, like Patrick said, a super intentional medicine. And if it wants to tell you something, it's going to tell you, whether it's a small dose. And we have a lady that does microdosing, and she very much is able to, with a very small, tiny little amount, put her her mask on, put some music on, and have a total, she can go right in and have a visionary experience with a microdose.
Now, dropping down even more like to the low and slow, you know, that's where you just add a little bit. And that's really, you know, utilized more and more now with addictions and helping people taper off and walk off you know, their opioid, right? A safe opioid. And it's the idea is just you're getting a lower amount, so it's less risk, you know, for cardiotoxicity and things like that, affecting the heart when people are already, say, jeopardized because of the different addictions and such like that. And the idea is you do it over a longer period of time, you know, 10 days, 2 weeks, and you end up getting a lot of this Ibogaine into the system at the end of the road. So the effects are good, you know, and they're lasting effects, but it's just not a quick up and down. You know, it's just like really low and that way there.
How long do people do slow and low? Like
About 10 to 14 days is a good rule of thumb. You know, you can go a little bit lower than that too, but it's depending on what they're coming for and what they're needing. It's super important. And, you know, it's very intentional every day, you know, and it really helps them like move through it in a very safe way. Whereas, say someone is going to do it's not a candidate for a flood dose, well, you can do a low and slow, providing everything still is safe enough for that, because there's still different set boundaries we have to go in between for that. Yeah.
And just because I've heard of it, but I don't exactly understand. A booster dose is
Booster dose is just an extra little dose in between the doses, just to get more Ibogaine, more
Yeah.
Iboga into the system, just helps them with
Like-
the connectivity.
Yeah, and I think too, we're seeing like booster doses as like a low dose that people get, like they'll get 1 or 2 for when they leave wherever they're going for treatment because they're not there long enough and they need a booster. It's usually for addiction.
Okay.
They need that booster because of something with pause is coming back. So post withdrawal, right? So the withdrawal symptoms are coming back even after treatment, and pause can last normally, like when we don't use, if we're not using Ibogaine and people just detox and do the traditional kind of way we've been doing it, pause can last for a year. So it helps with pause. And I think with some of these really like sticky drugs like fentanyl that really get into the fat cells, pause is even harder. So we need to be like mindful. And I think again, we're speaking to like, there isn't like a cookie cutter way of doing this. We need like to be looking at people individually and, a 3 or 5 day session with Iboga or Ibogaine may not be enough for some people. They may need a different type so that when they do leave, they're not in pause.
Got it. And is that post-addiction withdrawal symptoms?
Post-acute withdrawal system.
Post-acute withdrawal symptom. Yeah.
Okay, I see. Wow. So I mean, it's not just somebody learning about what it is, like the molecule itself, studying the molecule in a classroom, or it's really about watching people go through this medicine so you know what is going on. How long did it take for you guys to learn how to work with this medicine? How did you go about learning how to serve?
Well, I mean, I've been dosing for 30 years in ICU and emerge and such, and learning to titrate to effect. And so I really have a good understanding already of the body, how it reacts, different systems, and what it actually means to titrate by effect, et cetera, like that, right? And it's that practical application of how bodies respond to different medications and different things. So you get a really good understanding of that. And then, just when I started, it was just a matter of talking with the guy I was working with, and we were always talking about the dosing and what we think it should be, what kind of effect we're looking at, and watching it, giving a small dose and a layering effect, and see before we give them any more, see where they're at, do a bunch of different tests on the person to see how they are responding to the medicine, and then going a little bit more, and then a little bit more if we need to, and then stopping because we've arrived at the window of opportunity, right? The desired effect. So it takes time. You can't just do it on a weekend, feel like you're totally better and saved, and go out and start serving, because there's so much to it. So much to it. It's like, we're working with people's souls, we're working with their minds, with their bodies. This is a real specialty. We wouldn't just get our family practitioner to do brain surgery on us because, he has the basis, but he doesn't have the understanding or the practicality of it. So it does take a while.
Yeah.
Especially people starting from ground zero. It takes a while,
You feel like you needed to experience the medicine yourself to understand it?
Oh, yeah.
No, for sure. Yeah. You can't understand the medicine unless you have your own journey. And even though your journey is not going to be like anybody else's, but still a knowing and an understanding of how Iboga speaks to you and how it works with you. And it's a mind-blowing medicine. And on many levels, it blows your mind. It blows your mind like open so you can see. It helps you see the subconscious mind, which is the mind that's making all the decisions anyway. And it's just and it works with everybody individually. So that's what takes time to learn with Iboga. It takes time to understand that just because somebody doesn't have, and we talk about visions a lot because people get really hung up on them because they think an Ibogaine or an Iboga experience is visions. And maybe 50% of the time it's not,
Wow.
So it's not about the visuals. It is about the knowing of self. That's what it's about. And no matter what you use Iboga for, what category we put it under, whether it's for addiction, PTSD, whatever it is, chronic pain, whatever it is,
Wow, it
It
does a lot.
always comes back to knowing self. That's what it's
Yep.
about, to understand
Oh
you.
my gosh, we can talk for a really long time, and we'll get a chance to talk more
Yeah.
in the panel, but we'll get a chance to also hear from the different practitioners and what they use it for. I know that you, because of your experience, you can work with people with Parkinson's, people with chronic pain, people with PTSD, people with addictions. I know you don't quite really focus on addiction anymore. I know you've done that in the past. If people dosed, they saw you working very acutely with addiction, that documentary. There's so much more to discuss for sure, but I think this really gave people the basis of what this is. What are we talking about here? Because it is a really big medicine.
Yes, it is. Yeah.
And its effect, and also what it can do. And I'm so glad that we're gonna dive a little deeper, and maybe after the conference itself go into some stuff that we didn't get into, because we'll only have 40 minutes. So I'm really glad that we had this opportunity to share.
That's true.
Yeah.
Is there anything else you want to share about dosing or the medicine itself?
Just, do it with somebody. Don't, it's not a weekend warrior medicine. Don't
order it.
not a D.
No, yeah, take your time going into it. There's no rushing. There's no rushing. No matter how much you need it right now, like it's just everything's hanging on it. You still need to take your time preparing for it, having the right people there, and doing it in a safe way, because there's no sense having a spiritual awakening if you're not here to enjoy it in the physical body. That's not what it's for. That's not what it's for. And I'm telling you, it will happen.
Yeah.
And it's unfortunate. So we really need to take our time. You'll get there.
You'll get there.
You'll get there. Because we all actually have everything inside of us somewhere to get there without medicines. Just a matter of remembering, and this really helps us to remember. So take your time and do your due diligence.
Thank you so much, Patrick and Michele. I really appreciate your time, and I can't wait to dive in with the other panelists and
Good.
medicine a little bit more. Thank you. I'll see you in a week or so.
Yeah.
At Philadelic. Thank you so much for your time, and we'll see you then.
Thank you,
Okay.
Kim.
Okay, thanks. So bye.
Bye.